making sure children are healthy, safe, loved, ready to learn, succeeding in school and in life. This is Our Children, a program brought to you by the Children's Trust.
Good morning and Happy New Year. I'm Diana Ragbear, Director of Public Policy and Community Engagement at the Children's Trust.
And I'm Ileana Varela with the Herbert Wertheim College of Medicine at FIU, and together we welcome you to Our Children. The Florida legislative session began this week with an estimated $635 million revenue surplus and lots of ideas on how to spend it.
With last year's impasse over Medicaid expansion off the table, there is hope for greater consensus on child welfare, early childhood education, and children's health issues.
We begin with health, both physical and mental. To get the conversation started, we are joined today by Florida State Representative Jose Felix Diaz, an attorney and chair of both the Regulatory Affairs Committee and the Miami-Dade Delegation, a longtime and celebrated advocate of children's health and child abuse issues. Representative Diaz also serves on the board of the Children's Trust. And Steve Leifman, who is Associate Administrative Judge in the Criminal Division of Florida's 11th Judicial Circuit. Judge Leifman chairs the Florida Supreme Court's Task Force on Substance Abuse and Mental Health Issues. He also co-chairs the Miami-Dade County Mayor's Mental Health Task Force, and he serves on the Board of Directors of the American Psychiatric Foundation. So, good morning, gentlemen. Thank you for joining us.
Welcome to both of you. Chairman, let's start with you. Despite progress made in reducing the large number of uninsured children, a large number remain uninsured, particularly Hispanic children in Miami-Dade County. The Kid Care Bill for legal immigrant children is back for the third year in a row. Could it pass this year? And for those who are unfamiliar with the bill, please explain why it's so important.
Well, not only do I think it can pass, I think it will pass. And I haven't been this positive about this bill since we first started filing it almost 4 years ago. At that time, there was almost a $500 million fiscal impact. We've whittled that down and actually proven that this bill will save the state money on Medicaid dollars, which are some of the most coveted and protected dollars in our budget. It's an important bill because it does help almost 40,000 kids across the state that are currently uninsured. These are kids that come into the system with chronic health issues, and the best time to care for them is at the beginning of care.
There's something here, and it's immigration, which is a hot button issue, particularly this year around the country. And there are some of your colleagues for whom this is very sensitive. Can you convince them that voting for this will not necessarily make them look like they're soft on immigration?
Well, I don't think this has anything to do with that. This is legal immigration, and I haven't heard a single colleague say they don't support legal immigration. It's the bedrock of this country. We are a great and prosperous nation because we've always supported and helped legal immigrants, and that's who this bill specifically targets. People who did things the right way, they applied, they got here on their own merits, and now it's time to make sure that their kids are taken care of.
So you just have to make that distinction, make it clear.
It's an easy distinction. I mean, the only population that's covered is the legal immigrant population, which again, you listen to everybody from CNN to Fox News, and everybody agrees legal immigration is good. Illegal immigration is what's a little problematic.
That's very encouraging. Now on the subject of mental health, here are some astounding figures. Miami-Dade County is home to the largest percentage of people with serious mental illnesses of any urban community in the United States. This includes schizophrenia, bipolar disorder, and major depression. We're talking about more than 9% of the population, and fewer than 13% of these individuals receive care in the public mental health system. Judge Leifman, we're now understanding that mental health is just as important as physical health, and that mental health issues and substance abuse are among the underlying root causes of child abuse. Tell us what you are focusing on this session to help combat this overwhelming problem and keep more children safe.
Well, thank you for bringing up the topic, because people for too long have not appreciated that the head is connected to the body.
Exactly.
And it really is directly related with someone's physical health. And child abuse, when people are traumatized, It's a physiological reaction. It's not an emotional response. The brain activity is altered when someone is horribly traumatized. In fact, over 90% of the women who are in jail and prison in the United States were sexually abused as that have serious mental illnesses were sexually abused as children. And we never address those issues. And so it's critically important that we change that dynamic. So one thing that we're doing locally is we've begun a program called Typical or Troubled, where we're now educating every elementary, middle, and high school teacher, cafeteria worker, bus driver, and coach on how to identify the signs and symptoms of children that are exhibiting signs of serious mental illnesses. You know, why are we waiting for kids to grow up sick and end up in the criminal and adult system when we can address these systems? I think what a lot of people don't understand is that recovery rates for people with mental illnesses are actually better than people with diabetes and heart disease. The key is getting them early, identifying early, and getting them treated early. On the legislative level, we have several bills that I am cautiously optimistic about. Our task force has made several recommendations to the legislature over the last several years, but a couple of them are moving quite well right now. One of them would expand mental health courts. It would make it easier for county court judges to have more authority for people that are incompetent on misdemeanor cases to help get them treated. It would spend the tax dollars more appropriately. Florida, unfortunately, spends a lot of its money on the acute end, and it's too late at that point. And so we're trying to change that dynamic by changing the services that should be available for people. And so there's one bill that's being sponsored by Chairman McBurney and Senator Diaz who both chaired the criminal justice committees. That bill is moving quite well. And we're also looking at seeing how we can improve ways to make easier access for Baker Act and Marchman Act, and those are the mental health and substance abuse and voluntary hospitalization bills, and maybe even working to alter some of the criteria to get people treated. But all this also goes back to financing. I mean, unfortunately, Florida is still 49th per capita in mental health funding, and we can have the best laws in the world. If we don't have enough dollars to get people the services they need, they're going to fall through the cracks. And I think if we're able to really help people improve their mental health issues, they can become productive in our society. There'll be less criminal issues. They'll be contributing to the tax pool. And instead of what we do now is we wait people to get sick and they end up in these very deep-ended systems.
I think you also mentioned something that I think is critical, and that's going back and nipping things in the butt early on, and as early as childhood, because we know that some of the people you're advocating for who are in the prison system now as adults, they were children once, and some of these people are carrying these problems since childhood, and screening needs to go back early on.
Well,
how do we do that?
I mentioned it earlier. I mean, 92% of all the women in jail and prison in the United States with serious mental illnesses were sexually abused as children. And, you know, their brain activity is altered is because of the trauma, and they're not treated. There are treatments. There's, you know, they have post-traumatic stress disorder, a lot of these kids. And some of these kids live in war zones, and they have PTSD issues. And if we address those issues, they're going to be better students, they're going to do better in school, and they're not going to grow up in another system that's only going to help them perpetuate the problems that they already have. I
think we could have this conversation. We'd love to have you, both of you, back and continue this conversation, because there's so much that we could talk about. But I'm sorry, we're out of time. Good luck to you both on this on this legislative session. So much work ahead. Up next, what can the legislature do to help our youngest citizens thrive? These little ones can't vote yet, but they will one day. Stay with us.
Daycare, childcare, babysitting. It may not matter to you now, but it should. When you're on the job, your children are either learning or not. So before you drop your children off someplace on the way to work, think about whether that place is going to prepare them for the future. Find a star-rated childcare center near you by visiting thechildrenstrust.org. The Children's Trust, because all children are our children. It's not about the classroom or the computers or how much money you make. It's not where you live or where you come from. When it comes to kids succeeding in school, the #1 factor is
Me.
Moi.
Yo.
Parents like me and you.
if you want to make a difference in your children's lives, read to them, be selective about their care, encourage them to get good grades. You have to be active and involved. To find the support you need, log on to thechildrenstrust.org. The Children's Trust, because all children are our children.
Welcome back. We're talking about important issues to watch this legislative session. Joining us now are David Lawrence Jr., founder of the Children's Trust and chair of the Children's Movement of Florida, and Evelio Torres, president and CEO of the Early Learning Coalition of Miami-Dade Monroe.
Gentlemen, welcome. Thank you for being with us this morning. Dave, we're going to start off with you. It's been said that children don't come with an operations manual. Too bad, because it would be really helpful, wouldn't it? I was wondering, if you had a wish list for things that parents need, what would be at the top of this wish list for the legislative session and what they could do for parents?
So nothing more important than a caring, knowledgeable parent. And I start with the premise that parents really do love their children, want to do right by them, but frequently don't know what to do. So with the support of the legislature and the governor, we've made significant progress toward 24-hour phone lines in 3 languages, English, Spanish, and Haitian Creole, that ultimately would be available in every county of this state. So a major item is called Help Me Grow. The governor has $4 million in his budget. We now are in 34 of the 67 counties. With this money, we would be in all 67 counties. It would be a very big deal, and the first state, frankly, of all the states that would have this available to every citizen at every hour of the day and night in 3 languages.
And we know that this has made a difference in the counties where it already exists.
Including Miami-Dade, where we've had it for basically the last 12 years or so. It's a very big deal. You can find out about breastfeeding and high-quality child care and how to hook your child to health insurance and what do I do if I'm having trouble doing whatever. And it's fully available. I need it at 2 in the morning or 7 at night. It's available.
Dave, you are the architect of our free voluntary pre-kindergarten program in Florida. How is it working, and what can legislators do to improve the program?
Okay, so I'm really glad that we have it. We're one of 3 states in the country where it's universally available: Oklahoma, Georgia, and Florida. It started in the school year 2005-2006. It started with $2,500 per child, per slot. We're still not back to $2,500 after cuts and so forth. We need to make more progress. We'll still, at the end of this year, if we get the recommendation from the governor's office, it'll be another $50, still putting us under $2,500. We need, frankly, to be at least at $2,700. I'm delighted we have this embedded in the Constitution. I'm pained that its quality is so frequently very much up and down.
Now, I know that for both of you, access to quality child care is very important, and we're going to address that. But first, I want to share some information with our viewers. 62% of working mothers here in Florida have infants, but quality care is unavailable or unaffordable to most of them. More than 25,000 babies are on the waiting list for subsidized care so their parents can work and pay taxes. So, Evelio, my question to you is, what does a waiting list look like in Miami-Dade County, and what can we do to reduce that number?
Well, you're correct in that there is a statewide waiting list. In Miami-Dade, we have no waiting list
Oh,
right
we don't?
now. We don't. For the first time in many, many years, we have been able to eliminate the wait list. Right. And that was due to us receiving some additional dollars from the legislature, which were very helpful in eliminating the wait list. And then the other, I think, significant progress that we have been able to make is in how parents apply for care, because parents can now apply online 24 hours a day, 7 days a week, which makes it a lot more convenient, particularly for parents who are working and are low-income parents, and they don't have to take time off of work to apply for care for their children.
Where do they do
However, let me just also add that the big challenge that we have is, even if we have no wait list, is that quality care is still hard to come by. So we're trying to make some progress in the standards in Florida, which are so important.
So you said parents can apply online. How do they do that?
They go through our website, and there's an application process. The first thing they do is they fill out a preliminary application. We review that application and then send them the full application so they can enter into the program if they qualify based on federal and state guidelines, income mostly.
And your website is?
It's www.elcmdm.org.
Perfect.
I'm glad you mentioned childcare standards, because quality is so important. As you both know, childcare standards in Florida are abysmal, among the worst in the nation. In fact, with no group size limits, no educational requirements for instructors, and no sex offender registry checks for staff in direct contact with children. Is there anything on the horizon to address these issues this session? Either of you?
Well, standards, you know, it's something that we continue to discuss every session, and we've had a couple of bills that have failed over the last couple of sessions. One of them on the last day of session 2 years ago, and we're hoping that we're going to see some discussion about improving standards in Florida. But as Dave mentioned, it's not only the standards, we also need to increase the reimbursement rate for the rates for the child care providers, because higher standards usually means that it costs the child care providers a bit more money, whether it's with ratios, child-to-teacher ratios, or some of the other things they need to implement in the classrooms. So I think that the pay needs to go along with improving the standards.
We have some legislators who really care about this issue. Marlene O'Toole from North Central Florida would be a good example. We have people in Miami. Pepe Diaz is one of them. Eric Frezin is another one. Rene Garcia is another one. I think we're poised this year to make some real progress in terms of quality and standards.
That would be wonderful.
Well, at least it looks like we're on the right track.
We are.
Thank you both for joining us, and I hope you're right. I hope we are on the right track. Well, these are certainly important subjects. Let's hope we can make some progress in Tallahassee. Up next, we're going to talk about continued efforts to strengthen the child welfare system and keep more children safe from abuse. Don't go away.
The reward has been beyond what we could have ever imagined.
I think that you have to go into this with an open heart.
Anyone who even has a small thought of being able to do it can do this, because everyone has that heart to give.
The Children's Trust urges you to consider adoption. Log on to MiamiHeartGallery.org to see and hear from children who need your love. The Children's Trust, because all children are our children.
I can't imagine my life without them.
Put down all your prejudice and just love them.
Fear prevents us from doing things that are life-changing, that make the difference in the world.
It is scary, but it's something that you can do.
The Children's Trust urges you to consider adoption. Log on to MiamiHeartGallery.org to see and hear from children who need your love. The Children's Trust, because all children are our children.
And when I looked at this little girl, I knew she was mine.
Welcome back. Keeping children safe from abuse and neglect has been a priority in the past 2 legislative sessions. This has resulted in policy change and consecutive budget increases to the child welfare system. But there is still much work to be done. More than half of Florida's abused children are under 5, and the majority are removed from their parents before their first birthday.
Joining us now with his insight on the subject is interim president and CEO of the Children's Trust, Imran Ali. Mr. Ali previously served as Director of Operations for all programs at the Miami-Dade Department of Children and Families and Director of Child Welfare. He also was Program Director for the Children's Home Society of Florida, and in 1994 he served on President Clinton's Adoption Committee. Imran, nice to see you.
Hi, nice to meet you.
Imran, you have vast experience in this arena. What are some of the ongoing challenges in this area?
Since the story in the Miami Herald a few years ago, there have been a lot of challenges. The number of children coming into care has increased by 31%. The number of children being served in home has increased by 63%. So I think the focus has changed to trying to keep the child's safety first, and we've seen that that has triggered a lot of changes legislatively and policy-wise. A major challenge is the turnover of staff also. Protective investigators, case managers, there's always that ongoing problem. It's not a problem endemic only to Miami-Dade, but statewide and nationwide it's a problem that you find that staff doesn't stick around a lot. So because of that, there's always been a challenge in maintaining good quality staff. So I think as we move forward, the funding and making sure that we keep staff that are qualified and better trained is important to make sure that the safety of the child remains paramount.
So what else needs to be done on the legislative level to continue the progress? Because obviously, I think we've made progress. I think you'd agree that we've made, you know, steady progress. But what else needs to be done to continue that?
Well, I think the governor has really made some significant progress. You know, I think he's increased the number of protective investigators. I think in this year's budget, he has an increase of over $22 million for case managers that will continue to serve the kids. So that's going a far way. I think we need to make sure that there is enough funding for intervention and prevention services also. I think in this year's budget also, they're looking at increasing the number of guardians ad litem. You know, there's always a shortage for that, and while that program operates primarily on a volunteer basis, there's still need for enough staff to support the number of volunteers. You need to make sure that every child that comes into the child welfare system has a volunteer that looks and support the case managers and investigators and the judicial system. So I think from the legislative perspective, they're on the right track. You know, there's never enough funding for everything, but hopefully, you know, these additional funding will help to improve some of the services to the children that come into the child welfare system.
Is there anything that we can do to promote increased adoptions? I know that children, you know, really thrive in loving homes, and some unfortunately do have to be removed. But what can we do to promote adoption so that children aren't bounced around so much in foster homes and group homes?
Well, there's always a challenge there too, you know, with promoting adoptions. You know, for one, there are not a lot of families out there, especially for the older children. The younger kids seem to get adopted on a quicker basis. But I think in the past, some of the policies and legislation, you know, supported, you know, did not support the children, the siblings, you know, keeping in contact. I think that is going to change in the near future. But I think looking for quality adoptive homes is really a major concern that we need to continue to strive. You know, in Miami-Dade, our kids have been making some vast strides. The Children Trust have the Heart Gallery that we're trying to promote the number of kids that need adoption. But I think that we need to continue to look for quality homes. We need to make sure that the prospective adoptive families know a lot more of the children so the adoptive placements are not disrupted. So I think we need to look at that. The early assessments need to be focused on a lot more also. A lot of times the adoptive parents, when the adoption fail, it is because they feel that the child welfare system did not share enough information with them. So early assessments and sharing information, getting the kids more bonded with their adoptive parents are very important if you want to make sure you have successful adoptions.
We just got through talking with our earlier guests about the importance of mental health in all of this, and you know, having worked so closely, you know, with you know, the issue of child abuse, obviously mental health is key in the issue of child abuse. How far have we come in addressing that?
Well, I think there's a lot more screening tools. I don't think it's gotten to where it should be, But I think the early assessment for children who are abused and coming into the system, that the early screening is important. And once they get screened, the challenge is to what kind of services are out there. And that's not always adequate to provide the kind of services, mental health services that the children need. You know, substance abuse is also important. You know, a lot of the children come into the system because of substance abuse. You know, and it's compacted, you know, because of the mental health issues also from the parent perspective, a lot of dysfunctional families. So when they come in, there's so many dynamics with the children coming into care, you know, the substance abuse, the domestic violence, the mental health issues. So the early assessments, they're very important to try to provide the right continuum and array of services for the children coming into the system.
Right. What about home visitation? I know there are some really good evidence-based programs like Healthy Families where you have in-home visits which are voluntary to see what parents need. Are those important?
Yeah, anything to do with home visitation and parenting are very important if you want to stabilize the family and get them to permanency as quickly as possible. You know, there are a number of models out there, you know, the Home Builders Program, you know, the Old Family Builders Program, Miami-Dade. These are helping supporting the families, you know, in home, you know, to prevent the kids being removed. But likewise, when they get back into the home, they need a lot of services also. If you're going to make that, you know, reunification successful, you need to make sure the visitations are there, you know. And, you know, Healthy Start is a great program to help to prevent the kids coming in, but also at the same time, you need to make sure that once the kids go back home after being reunified, that they're stable and they have the necessary support and intervention programs to maintain that home placement.
Sounds like the key is more funding, though.
Yes, and we have seen the legislature increase funding over the last few years. We need them to continue that. I think they've just started to catch up. We really haven't gotten ahead. So now that we're caught up, let's continue to fund the programs properly so that we can prevent children from being abused and neglected in the first place. It's really much more effective to prevent problems from developing.
I think you would agree that we are beginning to see more funding.
Yeah, definitely. Years ago, back in the early, you know, 80s and 90s, you know, the whole child welfare system in Miami-Dade functioned on $50 million. There's well over $100 million. So
well, that's good to hear.
Yeah, it's a lot
more
more
obviously it's going to be a very busy legislative session as always.
For
and
sure.
Diana, I know you'll be spending a lot of time in Tallahassee.
Indeed,
so
indeed.
Take care of yourself. Good luck.
Thank
you for joining us. To keep up what's happening, please regularly visit the advocacy page at thechildrenstrust.org and sign up to receive Diana's weekly Capital Connection newsletter during session. I'm Ileana Varela. On behalf of the Children's Trust, Diana Ragbeer and Imran Ali, thanks to all of you for watching this special edition of Our Children. Enjoy the rest of your Saturday. Bye-bye.
Our Children is brought to you by the Children's Trust. The Children's Trust invests in programs and services that help make children healthy, safe, loved, ready to learn, succeed in school and in life. To access its funded programs and services in Miami-Dade County, visit thechildrenstrust.org or call the Children's Trust helpline at 211, because all children are our children.